Approximately 1,900 medical interns have been seated at home without being deployed for medical practice, with them having occasional demonstrations. During his budget speech, Finance Minister Honorable Matia Kasaija assured the nation that 22 billion has been earmarked for the deployment of medical interns as well as their salaries.
Government in the next few weeks resolves the plight of the medical interns and doctors designated as senior house officers in view of their important role in supporting the health care system. Government, we, in the next few weeks, resolve the plight of medical interns and doctors designated as senior house officers in view of their important role in supporting the healthcare system. So please, interns, calm down. We are coming to rescue you. In the meantime, I have provided shillings 22 billion to clear outstanding areas for medical interns and senior house officers for the financial year ending June this year.
This afternoon, a group of medics, among which are professors, medical doctors and intern medics, reached out to the Speaker of Parliament to express their worry over Ministry of Health's decision to make interns pay for their training contrary to the law. Speaker Among emphasized that Parliament has already given conditions to both Ministry of Finance and Ministry of Health to pay and deploy all intern medics, and failure to do so, Parliament will take action of not sitting until all is implemented.
And we are going to have money first paid, the 22 billion. You had it in the budget speech. It's going to be paid. If it is not paid, you will see that House will not sit. We will tell them, go and first pay, then we can have a sitting. So don't worry, we are handling. You don't even have to bring the senior professor. You get it, eh? You just need to give us a call and say how far.
Meanwhile, the Speaker has also raised fears of unplanned pay of incoming medical interns in the coming financial year as raised by Dr Obuku, saying that government will consider supplementary when the time comes.
Through you, of course, the Honourable House, because when we saw the appropriation, it was lacking. It had arrears, but it was lacking money for the incoming lot, about 60 billion. And then the senior house officers also, but also the issue of blood was also missing for the regional bank.
The incoming lot will sort it out. That's why we always have supplementaries. We have supplementaries. If there is an incoming lot that we don't know how many are incoming, how much will be required, that is where we have an option of a 3% that government can spend. Even if it is not on the 3%, we can seek for a supplementary to have the incoming paid on what the people who have been recruited. First, we need to know how many are recruited and how much is required. That's why we have that gap, that option of a supplementary.
The medical professors have cautioned government to start controlling the number of students getting into different institutions of learning if they do not have a budget for them when it comes to their medical practice.
Individuals who are trained by public institutions, which we call government, and others who are trained in private institutions, which we call private, are not being trained for those institutions. They are being trained for the nation. Government has a role, and I think is performing, I'm concluding soon, performing its role through the arm of National Educational Council to control the numbers if there is an unrest in government about the budget being exceeded, not to allow every institution to start training without the arm of government approving and ensuring that they will kind of meet the needs of the nation and not do it in excess so that the government's financial section suffers the burden of an excess number of personnel having to be financed.
There are about 1,900 medical interns who have been waiting for deployment in a period of 1 year and 4,000 medical students who have just completed their studies waiting for their medical training as well. Samlanifa, Smart 24 TV, Business Today.